When you walk into a hospital, you're just surrounded by this incredible high-tech world, right? You got monitors beeping, ventilators breathing, scanners creating these amazing images. It all just works. But have you ever really stopped to wonder how it all gets there? I mean, it's a huge puzzle. How does some super advanced piece of equipment from, say, Japan not only make its way to a community clinic in a place like Western India, but also get installed, kept in perfect working order, and fixed in an emergency 24/7? Well, there's a whole system that makes it happen, and that's what we're going to unpack. So here's how we're going to do it. We'll start with the big picture, this idea of an invisible backbone. Then we'll zoom right in on a real-world company, Bright Healthcare, to see how they connect global brands to local hospitals. We'll look at the absolutely essential services they provide, and then pull back out to see why these local partners are honestly one of the most important parts of modern healthcare. All right, so let's start there with this idea of an invisible backbone. You've got these giant multinational companies on one side, the ones inventing and building amazing medical tech. And way over on the other side, you have thousands of local hospitals and clinics that need that tech to save lives. There's a huge gap between them. And that gap, it's filled by this invisible network. It's made up of specialized regional partners who do all the critical work on the ground. You can think of them as translators, as technicians, as the local face for this global technology. Honestly, without them, the whole system just falls apart. Now, to make this idea really stick, let's look at a perfect case study, a company called Bright Healthcare, or BHC. They are a fantastic example of how this invisible network actually works day to day. So BHC got its start back in 2014. That means they've had about a decade to really build trust and deep expertise in the community they serve. They spotted a critical need, and they just stepped up to fill it. And what they do is super focused. It really comes down to three main things. First, providing those advanced medical imaging systems that let doctors see what's going on inside a patient. Second, supplying the critical care equipment for ICUs and operating rooms. And third, and this is so important, backing all of that up with expert biomedical engineering solutions. And here's what's so powerful about their model. Their focus isn't global, it's deeply, deeply local. They serve a very specific region within India. And you know what? That local knowledge is their superpower. It lets them respond faster and provide support that's truly tailored to the needs of their community. Okay, so if they're a local company, how do they get world-class technology into these regional hospitals? Well, it all comes down to building smart, strategic partnerships. You can see right here how BHC acts as that vital bridge. They're the official local partner for global giants like Olympus and Konica Minolta from Japan, bringing in top-of-the-line endoscopy and digital X-ray tech. But they also partner with leading Indian companies like Medion Healthcare. They're essentially curating the best technology from around the world and bringing it right to the hospital's doorstep. And they keep it all organized with two clear divisions. The medical imaging side is all about the diagnostic tools. You could call them the hospital's eyes. Then you have the critical care division, which handles the life support systems, the lungs and heart of the ICU, like ventilators and patient monitors. It's a really smart, comprehensive approach. But here's the thing, and it might be the most important point of all. Just selling the machine, that's actually the easy part. The real value, the thing that makes this whole system actually work for patients, is the service that comes after the sale. This is the crucial lifeline. I mean, this quote from BHC really gets to the heart of it. A ventilator is just a box if it's not working. An X-ray machine is useless if it's down. Their entire mission is to reduce that downtime because they know every single second counts when a life is on the line. And their process shows just how deep that commitment goes. It starts with a perfect installation, then comes preventative maintenance to catch problems before they even happen. But if a machine does go down, they have emergency services ready to roll. And it's all wrapped up with ongoing technical support contracts. So who makes all this happen? This is the best part. It's a dedicated team of highly trained biomedical engineers. These folks are the real heroes of the story, on call 24/7, ready to go fix a critical piece of equipment at 3 in the morning. They are the true backbone. And look at the ripple effect they have. It's not just the big city hospitals. They're serving diagnostic centers, smaller nursing homes, surgical centers, and even the medical colleges that are training our next generation of doctors and nurses. They touch the entire ecosystem. Okay, so let's zoom back out. We've seen how a company like Bright Healthcare does what it does. Now let's ask the big question. Why does this model matter so much? What's the real impact here? At the end of the day, a regional partner is basically a force multiplier. They're a translator because they understand the complex language of global tech and the unique needs of their local community. They are the bridge connecting those two worlds, and they're the support system that makes sure that bridge never breaks. So if you had to boil it all down, the value they create is threefold. One, they give local communities access to world-class technology. Two, they provide that on-the-ground local expertise that a giant corporation thousands of miles away just can't offer. And three, the direct result of that support is less broken equipment, which means better care for patients. Simple as that. And that's really the crucial takeaway. This invisible backbone of local partners is absolutely essential. They are the final critical link in the chain that gets life-saving technology into the hands of the people who need it most. Without them, all that amazing innovation just stays stuck in a lab, far, far away from the patients it was meant to save.
It really makes you think, doesn't it? This idea of a local expert being the bridge between the global and the local, that doesn't just apply to healthcare. So, I'll leave you with this question to chew on. What other invisible backbones are out there, quietly making sure your community works every single day?